Do air compression boots really help your muscles recover faster? In this video, I'll explain what research really says about air compression boots. Now note this video is sponsored by CINCOM. So I'm first going to tell you a little bit about air compression boots in general, then I'll tell you a little bit about this air compression recovery system by CINCOM and some of the unique features of it. So first of all, what is air compression? Air compression is where the boots fill up intermittently from segment to segment to segment, starting at your feet and pushing back up towards your heart. The goal is to improve circulation, and these have long been used in hospitals to prevent blood clots, say after surgery, or to help with swelling in conditions like lymphedema. Now, note these ones are more for wellness and for athletic recovery or recovery after exercise. So if you are going to use it for more of a medical purpose, I would suggest checking with your doctor just to make sure you're safe doing so. Now, as far as muscle recovery for athletics, there's been a growing amount of research over the last few years about air compression boots, and the term you'll see in the medical research is called intermittent pneumatic compression, or IPC for short. That basically means the compression isn't on all the time, it's inflating and deflating throughout the course of the treatment. Now, in terms of using IPC for muscle recovery, the research varies in the results. The most consistent result is for prevention of delayed onset muscle soreness. Now, there have been other things that have been researched as far as improving athletic performance after using them, and they found that largely they don't affect athletic performance except for within a period immediately after using them. For example, 0 to 2 hours. Now that can be helpful if you're using them to recover between events. For example, if you run track and you're using them between a first event and a last event, or if you're at an all-day tennis tournament or something like that, you can use them in the short term to help with recovery. But overall, they don't have a long-lasting result on athletic performance. They've also studied different biomarkers of muscle damage in terms of intermittent pneumatic compression, and they found that creatine kinase levels, which is an enzyme that reflects muscle damage, largely isn't affected by intermittent pneumatic compression. But what they have found is that there's a consistent trend that intermittent pneumatic compression does help with delayed onset muscle soreness. There's a very strong trend and statistically significant at that 0 to 2 hour period immediately after you take them off. And I will tell you, your legs do feel really good right when you get out of using these things. Then they've also found that 4 days after using them, intermittent pneumatic compression has a statistically significant improvement over the control treatment, whatever they were studying in the various other study. Now, in that 1, 2, and 3 day period afterwards, that's where it's a little bit more variable. In general, the trend does tend to favor intermittent pneumatic compression at all time points. However, it's just short of significance at 1, 2, and 3 days after using them. But again, the trend does tend to favor towards intermittent pneumatic compression much more so than it does towards a control treatment. Now, what about these boots in particular? I think they feel really good to work the lactic acid out of your legs after a hard leg workout, but they're primarily used for endurance athletes. Now, my wife is a marathon runner and runs on average about 50 miles a week, and she uses compression boots every single day. She also has restless legs at night, but she thinks the compression boots help her sleep better at night. So these aren't our first pair of compression boots. But what I really like about these ones is that they are zip up, so they're nice and easy to apply. The other pair that we have is Velcro, and it does work rather well, but you have to Velcro the straps all the way up, and it's kind of a pain in the butt to put on and take off, and then you have to worry about getting all the Velcro straps tangled. These ones are nice and easy. You just zip them up, zip them down, and you can slide right in. Additionally, these are not one size fits all, but one size does fit many. They come in 3 different sizes: small, medium, and large, largely based on your height. These are a size small, which goes basically all the way up to 5'9". So if you're shorter than 5'9", a small will probably work for you. If you're taller, I'll put a size guide up on the screen here, and it's also on the Amazon page, at least at the time of recording this. So next, moving on to the specifics about how the device inflates. In general, all of the modes on this start at the foot and then start building up. It has a sequence mode, a circulation mode, and then a combination, which is basically a combination of the two of those. Now, all of them do help improve circulation, but essentially they're going to start from the bottom and inflate gradually, segment by segment. And there are 6 different air chambers in this one, which is something that I do like about this one as well. So it's essentially taking the fluid and pushing it back up through your veins, helping to return it to your heart. Or if you do have some swelling that's accumulated in your tissues, it's pushing it back up closer to your heart. Now, depending on the specific program that you're using, it'll do the full segment and then say 2 segments at a time going up to the heart, and then it'll go back to doing the full segment again. So if you kind of picture someone doing a massage, pushing fluid along your leg, or rather it would be this direction back towards the heart, that's kind of what it tends to mimic, but you can do it on your own. You don't need to go see a massage therapist for it. Now, as far as the pressure settings, this one goes from 50 millimeters mercury pressure all the way up to 150 millimeters mercury pressure in increments of 10. So you can do 50, 60, 70, 80, so on and so forth. Now, what research has shown is that the most common settings for using these is at 80 millimeters mercury, which is what I have this set at right now, for 20 to 30 minutes. Now, I've found that with this, at 50, 60, and 70, it didn't really feel strong enough. 80 feels very comfortable. I have gone up as high as 90, and 90 actually still feels pretty good. It feels like a strong massage, but it's kind of getting to the point at 90 where I wouldn't want to go any higher than that because I think it would start to become painful. Now, if you think about the way that these things actually work, they're supposed to push blood back up along your veins. But remember, blood still has to go down your arteries the other way. Now, when you're taking your blood pressure in the arm, a normal blood pressure is 120 over 80, or actually a little bit lower than that. The blood pressure does tend to be a little higher in the legs than it is in the arm because gravity is pulling down that way. But if you consider that when your heart is squeezing, blood pressure is around 120. When your heart is relaxed, it's around 80. If you start going too much higher than those pressures, you're actually compressing the arteries as well, which isn't necessarily a good thing. So if you start to notice that your feet are getting cold or numb while using these, you probably have the pressure too high. And again, with athletes, they tend to think, oh, I want to do the most, but more is not necessarily better in this case. So I would strongly discourage you from going significantly higher than 100, or at least be very careful if you're going to be doing that. When you're done using these, you can fold up the boots and put them in the travel bag. That makes them easy to take with you either to the gym, or if you're traveling for a competition or going on vacation, they do travel rather easily. So if you'd like to check out these CINCOM boots, again, they are available on Amazon, and I'll put a link down in the description below. Thanks for watching, and I'll see you in the next video.